Our next presentation is going to be from Biodent, and that's Robert Rutner again.
Good morning again. One product that everybody loves is Numbee. We've all given shots. We've all gotten shots. Everybody hates it. The nice thing about Numbee, it simplifies it. It allows us to give a quote-unquote shot without a needle. It's comfortable. It's something that can be used for single-tooth anesthesia. It's immediate onset and allows you to be efficient and work right away. So what Numbee is we'll take the sting out of the anesthesia. It's a PDL injection without the needle. Many of you are familiar with a ligament jet. A ligament jet, this works the same way, but with the ligament jet, it's still a needle. The first couple of pumps on a ligament jet, you're taking that needle, injecting it into the ligament, and there is a bit of pain associated with it. It's effective for 20 to 25 minutes. This is simple in the sense of it's not a needle. You'll put it into the gum, squeeze a little bit to numb that level of the gum. Then it allows you to push a little bit harder to create a seal so that you can go ahead and numb your tooth. It's great for people that are needle phobic, which most of us are. It also has the advantage that then the lip, the tongue, any other ancillary structures don't get numb. So when we look at it, it's great for pediatric patients. You can do anything on a kid's tooth with this. You pull teeth, do restorations, etc. And since there's no needle, no fear. In fact, when I do this on kids, I actually let them touch it first. They like to play it with it, look at it, and I say, I'm going to put this on your gum, and I'm going to numb your tooth. And most kids are always afraid of that needle, but once they see that, you'll see the kids calm down right off the bat. The numbness, as I said, is confined just to the tooth. So it allows you the ability to get working right away, and it allows that you don't have the extra structures numb. So the patients like that. Limited soft tissue anesthesia. Excuse me. So therefore, the discomfort in and around the gums is generally eliminated. So for patients that don't like that experience of being numb, this type of anesthesia is very quick. Obviously for the doctor, for us, time is money. When we have a crying patient or a fearful patient, it adds us stress, and it just takes us longer to do anything. So with this, anesthesia, as I said, is immediate. Anesthesia lasts generally 20 to 25 minutes. So as with all dental products, you can't use everything in every space. If you're doing 4 or 5 teeth on the lower, this would be too slow. I would use a block for that. However, that's not the bulk of our practices. The bulk of our practice are fixing 1 or 2 teeth at a time, and this is excellent. Again, it's an innovative design, which is nice. Patients can touch it. They don't get afraid of it. So we're going to put a little bit on the corner there just to, as you see the tissue blanch. And now that area of the tissue is numb, so we're going to rotate that into the sulcus and slowly put more material in. You'll feel the back pressure. You got to use a little bit of pressure. We do sell a syringe with it, and that helps to do it. You can use this in a regular syringe as well. It's just a little harder to put in. So you can see here, now all of a sudden, we're getting that blanching. and that blanching means that the patient is numb. We sell it in boxes of 40. We do have a convention special, 2 boxes of material plus the syringe. That's a convention special. It's also available through Benco. They also distribute it as well. We are booth 2125. The booth is Biodent. Come by the booth and come take a look at Numbee because it's excellent. Thank you.